Today we are talking about English at the pharmacy. We will cover the phrases you need to describe symptoms, ask for medicine, talk to the pharmacist, understand their questions, and handle payment. By the end of this video, you will feel ready to walk into any pharmacy and speak with confidence. Let's get started right away. Let's begin with why this topic matters so much. A pharmacy is one of those places where you cannot afford to misunderstand something. If you get the wrong medicine, or you take the wrong dosage, it can actually be dangerous. That is why pharmacy English is not just useful. It is important. It protects your health. It also builds your confidence, because once you can handle a real conversation about your body and your health in English, almost any other daily conversation will feel easier. Many learners study grammar for years, but they freeze in real situations like this one. The good news is that pharmacy conversations follow a pattern. Once you learn that pattern, and once you learn the key phrases, you can reuse them again and again. So let's break this down step by step, starting from the moment you walk through the door. When you enter a pharmacy, you will usually hear a friendly greeting. The pharmacist or the assistant behind the counter might say, "Hi there, how can I help you today?" Or they might say, "Good morning. What can I do for you?" These are simple greetings, but your answer matters. You do not need a long sentence. You can simply say, "Hi, I need something for a headache." Or, "Hello, I'm looking for cold medicine." Keep your answer short and clear. Short answers are actually better in these situations, because they are easier to say under pressure and they get straight to the point. Let's look at some useful opening phrases you can use as soon as you walk in. You can say, "Excuse me, could you help me with something?" You can say, "I'm not feeling well, and I need some advice." You can say, "Do you have anything for a sore throat?" You can say, "I need to pick up a prescription." You can say, "I'd like to speak to the pharmacist, please." Notice that all of these are short and direct. That is exactly the style you want to copy. Now let's move to one of the most important parts of any pharmacy visit, which is describing your symptoms. This is often the part that scares learners the most, because your body can feel so many different things, and English has a specific word or phrase for almost every feeling. Let's go through the most common ones together. If your head hurts, you say, "I have a headache." If your stomach hurts, you say, "I have a stomachache." If your throat hurts, you say, "I have a sore throat." If your whole body feels sore, you say, "My body aches," or "I feel achy all over." If you have a runny nose, you say, "I have a runny nose." If your nose is blocked, you say, "I have a stuffy nose," or "My nose is blocked." If you are coughing, you say, "I have a cough." If you have a fever, you say, "I think I have a fever," or "I feel feverish." If you feel dizzy, you say, "I feel dizzy." If you feel like vomiting, you say, "I feel nauseous," or "I feel sick to my stomach." If you actually vomited, you say, "I've been throwing up." If you have diarrhea, you can say, "I have an upset stomach," which is a softer and more polite way to describe it. If you cannot sleep, you say, "I've been having trouble sleeping." If you feel very tired, you say, "I've been feeling really tired lately," or "I have no energy." These phrases are the foundation of almost every pharmacy conversation. Try saying them out loud right now, even if you are just watching this video at home. Repetition out loud is what moves these phrases from your memory into your mouth, so that they come out naturally when you actually need them. Let's also talk about how long you have had these symptoms, because the pharmacist will almost always ask that question. They might say, "How long have you had this?" Or, "How long have you been feeling like this?" To answer, you use the structure, "I've had it for," followed by a time period. For example, "I've had it for 2 days." Or, "I've had a cough for about a week." You can also say, "It started yesterday," or "It started this morning," or "It's been going on for a few days now." Another common question is about the intensity, or the type of pain. The pharmacist might ask, "Is the pain sharp or dull? Is it constant or does it come and go?" You can answer, "It's a dull ache, it comes and goes," or "It's a sharp pain, and it's constant." Learning these descriptive words, like sharp, dull, constant, and occasional will help you sound much more precise and natural. Now let's move to the next big section, which is asking for over-the-counter medicine. Over-the-counter medicine means medicine you can buy without a doctor's prescription. This includes things like pain relievers, cold medicine, allergy medicine, and so on. Here are the phrases you need. You can say, "Do you have anything for a headache?" You can say, "What would you recommend for a cold?" You can say, "I need something to bring down a fever." You can say, "Is there anything I can take for allergies?" You can say, "What's good for an upset stomach?" You can say, "Can you recommend a pain reliever?" Notice the pattern here. A lot of these questions use the words, "What would you recommend?" or "Do you have anything for?" These two patterns alone will help you ask for almost any type of medicine. The pharmacist will often respond with a suggestion. They might say, "I'd recommend this one, it works well for headaches." Or, "This should help with your symptoms." Or, "Try taking this twice a day." Listen carefully for words like recommend, suggest, and should help, because these tell you that they are giving you advice, not just information. Sometimes the pharmacist will ask you follow-up questions before recommending anything. This is actually a very important part of the conversation because it shows they care about giving you the right medicine. They might ask, "Are you taking any other medication? Do you have any allergies? Are you pregnant or breastfeeding? Do you have any medical conditions like high blood pressure or diabetes?" These questions might feel personal, but they are completely normal and they exist to keep you safe. Here is how you can answer these questions. If you are not taking anything else, you say, "No, I'm not currently taking any other medication." If you are taking something, you say, "Yes, I'm taking," and then you name the medicine. For example, "Yes, I'm taking blood pressure medication." If you have allergies, you say, "Yes, I'm allergic to penicillin," or "Yes, I have a peanut allergy." If you have no allergies, you simply say, "No, I don't have any allergies that I know of." That last phrase, "that I know of," is a very natural addition, and native speakers use it a lot, so try to remember it. Let's now talk about dosage instructions, because understanding these correctly is extremely important. The pharmacist might say, "Take 1 tablet every 4 to 6 hours," or "Take 2 capsules 3 times a day," or "Take this with food," or "Take this on an empty stomach," or "Do not exceed 4 doses in 24 hours," or "Avoid alcohol while taking this medication." These instructions use very specific vocabulary, so let's break them down. The word tablet refers to a solid pill, usually round or oval. The word capsule refers to a pill that often looks like a small container with powder or liquid inside. The word dose refers to the amount you take at one time. The phrase "with food" means you should eat something before or while taking the medicine. The phrase "on an empty stomach" means you should take it before eating anything. The word exceed means to go over a certain amount. So if someone says, "Do not exceed 4 doses," it means you should never take more than 4 doses. If you don't understand a dosage instruction, it is completely fine, and actually very smart, to ask for clarification. You can say, "Sorry, could you repeat that?" You can say, "So I take 1 every 4 hours. Is that right?" You can say, "Could you write that down for me, please?" You can say, "Just to confirm, I take this twice a day." Correct. Asking someone to confirm information is one of the most useful skills in any language, not just English, because it protects you from mistakes. Now let's move to a slightly different situation, which is picking up a prescription. A prescription is a written order from a doctor for a specific medicine. Here are the phrases you will need. You can say, "Hi, I'm here to pick up a prescription." You can say, "It's under the name," and then you say your name. You can say, "My doctor sent a prescription here earlier today." You can say, "I called earlier to refill my prescription." The word refill means to get more of the same medicine you already had before. So if you are getting the same medicine again, you say, "I'd like to refill my prescription for," and then the name of the medicine. The pharmacist might respond with something like, "Let me check that for you," or it'll be ready in about 15 minutes, or I'm sorry, we don't have that in stock right now, or we're waiting on approval from your insurance. These are all common responses, and understanding them will help you know exactly what is happening with your medicine. If they say it is not ready, you might want to ask, how long will it take? Or, can I wait here? Or, should I come back later? If they say they don't have it in stock, meaning they don't currently have that medicine available, you can ask, do you know when you'll get more in? Or, is there a similar medicine you could recommend instead? This shows flexibility, and pharmacists appreciate when patients are cooperative and open to alternatives. Let's talk now about a very important topic, which is side effects. A side effect is an unwanted or unexpected reaction to a medicine. This is something you should always ask about, especially with new medication. Here are useful phrases. You can ask, are there any side effects I should know about? You can ask, what should I do if I have a reaction? You can ask, is it normal to feel drowsy after taking this? You can ask, can this be taken with other medications I'm on? You can ask, will this make me sleepy? You can ask, is it safe to drive after taking this? The pharmacist might answer, this can cause drowsiness, so avoid driving after taking it. Or, some people experience mild stomach upset. Or, if you notice a rash or difficulty breathing, stop taking it and seek medical help immediately. That last phrase is extremely important because it describes a serious allergic reaction. If you ever hear the words difficulty breathing, swelling, or rash in the context of a warning, please take it seriously and get medical help right away. Now, let's shift to the payment part of the pharmacy visit because this is another situation where clear communication matters. In many English-speaking countries, especially the United States, insurance plays a big role in how much you pay for medicine. Here are the key phrases. The pharmacist might ask, do you have insurance? You can answer, yes, here's my insurance card. Or, no, I'll be paying out of pocket. The phrase out of pocket means paying the full price yourself, without insurance covering any of it. They might say, your copay is $15. The word copay refers to the fixed amount you pay even if you have insurance. They might say, your insurance didn't cover this medication. Or, we need prior authorization from your doctor before we can fill this. If the price feels high, you can ask, is there a generic version available? A generic version is a cheaper version of the same medicine, made by a different company, but with the same active ingredients. Asking about generics is a very smart and very common thing to do, and pharmacists expect this question often. You can also ask, do you have any discount programs? Or, is there a cheaper alternative? These are completely normal and polite questions. Nobody will think it is strange or rude to ask about cost, because healthcare costs are a common topic of conversation in many countries. Now that we've covered all these individual phrases, let's put everything together with a few full example conversations. Listening to complete dialogues will help you understand how these phrases connect naturally in a real conversation. Let's start with the first one. Imagine you walk into the pharmacy with a cold. The pharmacist says, "Hi there, how can I help you today?" You say, "Hi, I have a really bad cold, and I'm looking for something to help." The pharmacist says, "Okay, what symptoms are you having exactly?" You say, "I have a stuffy nose, a sore throat, and a bit of a cough." The pharmacist says, "How long have you had these symptoms?" You say, "About 3 days now." The pharmacist says, "Do you have any allergies, or are you taking any other medication?" You say, "No, I'm not taking anything else, and I don't have any allergies." The pharmacist says, "Okay, I'd recommend this cold and flu tablet. Take one every 6 hours and make sure to drink plenty of water." You say, "Great, thank you. Should I take it with food?" The pharmacist says, "Yes, it's best to take it with food to avoid an upset stomach." You say, "Perfect, I'll do that. Thank you so much for your help." The pharmacist says, "You're welcome. Feel better soon." Notice how natural and short each line is. Nobody uses long, complicated sentences here. That is exactly the level you should aim for in real conversations, especially at the beginning of your speaking journey. Let's look at a second example, this time about picking up a prescription. You walk in and say, "Hi, I'm here to pick up a prescription." The pharmacist says, "Sure, can I get your name and date of birth?" You say your name and date of birth clearly. The pharmacist says, "Let me check that for you, one moment please." After a moment, they say, "Okay, I found it, it'll be about 10 minutes. You say, "That's fine, I'll wait." A few minutes later, they call your name and say, "Here you go, this is your prescription. Take one tablet twice a day with food. Do you have any questions?" You say, "Yes, actually, are there any side effects I should know about?" The pharmacist says, "Some people feel a bit drowsy, so it's best to avoid driving until you know how it affects you." You say, "Got it, thank you very much." The pharmacist says, "You're welcome, have a good day." Let's look at a third example, this time focused on insurance and payment. Since this situation often creates stress for learners, you walk up to the counter and say, "Hi, I'd like to pick up my prescription, please." The pharmacist checks and says, "Sure, that'll be $45. You say, "Oh, that seems high. Is there a generic version available?" The pharmacist says, "Let me check. Yes, actually there is. It would only be $12. You say, "That's much better. I'll take the generic version, please." The pharmacist says, "No problem, I'll switch that for you now." A moment later they say, "Here you go. That'll be $12. You say, "Thank you so much. Here's my card." These three dialogues cover most of the situations you will face at a real pharmacy. Try pausing the video after this section and repeating each line out loud. Reading along and speaking at the same time is one of the fastest ways to build real speaking fluency because it trains your mouth, not just your brain. Now, let's talk about some common mistakes learners make in this specific context so you can avoid them. The first common mistake is translating directly from your native language, which sometimes creates strange or incorrect phrases in English. For example, some learners say, "I have pain in my head," instead of the more natural, "I have a headache." Both are understandable, but native speakers will almost always use the second version. Try to memorize these natural chunks of language instead of translating word by word. The second common mistake is being too formal or too complicated when a short phrase would work perfectly. For example, instead of saying, "I would like to inquire about the possibility of purchasing a remedy for my current headache condition," you can simply say, "Do you have anything for a headache?" Simple is almost always better in real spoken English, especially in everyday situations like this one. The third common mistake is not asking for clarification when something is unclear. Many learners feel embarrassed to ask the pharmacist to repeat something, so they just nod and say yes, even when they didn't understand. This can actually be dangerous with medicine instructions. Please remember, it is always okay and actually very smart to say, "Sorry, could you say that again?" Or, "Could you explain that a bit more slowly?" Native speakers ask for clarification all the time, even with each other, so there is nothing to be embarrassed about. The fourth common mistake is forgetting the polite softeners that native English speakers use so often. Words and phrases like, "Excuse me," "Could you," "Would you mind," and "Do you think?" make your speech sound more natural and polite. Compare, "Give me something for a cough," with "Could I get something for a cough, please?" The second version sounds much more natural and polite in English. Now, let's do a quick pronunciation and practice section so you can train your speaking muscles directly. I'll say a phrase, and I want you to repeat it out loud, even if you're alone right now. Ready? Let's begin. Say this after me. I have a headache. Again, I have a headache. Now this one. I have a sore throat. Again, I have a sore throat. Now this one. Do you have anything for a cold? Again, do you have anything for a cold? Now this one. How long have you had this? Again, how long have you had this? Now this one. Are there any side effects? Again, are there any side effects? Now this one. I'd like to refill my prescription. Again, I'd like to refill my prescription. Now this one. Is there a generic version available? Again, Is there a generic version available? Great job! Repeating out loud like this, even for just a few minutes a day, builds real muscle memory in your mouth and your brain. This is exactly how children learn their first language, through repetition and imitation, and it works just as well for adults learning a new language. Let's also cover a few extra vocabulary words that are useful in this context, even if they didn't fit naturally into the earlier phrases. The word pharmacist refers to the trained professional who works at the pharmacy and gives advice about medicine. The word pharmacy technician refers to someone who assists the pharmacist but may not be able to give medical advice directly. The word receipt refers to the paper proof of your purchase. The word label refers to the printed information on the medicine bottle or box, including dosage instructions. The word expiration date refers to the date after which the medicine should not be used anymore. The phrase, "keep out of reach of children," is a very common warning printed on medicine packaging. The word symptom refers to a sign that shows something is wrong with your body. The word remedy refers to something that treats an illness. The word relief refers to the feeling of a symptom becoming better or disappearing. Understanding these extra words will help you read medicine labels and understand pharmacy conversations even more completely. I'd recommend pausing here and writing these words down somewhere, maybe in a notebook or in your notes app so you can review them later. Let's now talk briefly about cultural differences you might notice at pharmacies in different English-speaking countries, because this can help you understand the tone of these conversations better. In the United States, pharmacies are often part of larger stores, like a supermarket or a drugstore chain, and the pharmacist usually works from a small counter inside the store. In the United Kingdom, pharmacies are often called chemists, and you might hear someone say, "I'm going to the chemist," instead of, "I'm going to the pharmacy." In Canada and Australia, both words, pharmacy and chemist or drugstore, are commonly understood, though pharmacy is more standard. In many of these countries, pharmacists play a bigger role than just handing out medicine. They often give quick health advice for minor issues, which means you don't always need to see a doctor for small problems like a cold or a headache. This is actually a great opportunity for you to practice your English, because pharmacists are trained to communicate clearly and patiently, which makes them a friendly audience for language learners. Let's also talk about what to do if you don't know the English name for a specific symptom or condition. This happens to everyone at some point, even advanced speakers. In this situation, you have a few strategies you can use. First, you can describe the feeling instead of naming it directly. For example, if you don't know the word for a specific skin condition, you can say, "My skin feels itchy and red in this area." Second, you can point to the area of your body and say, "It hurts here," while pointing. Third, you can use your phone to quickly translate the word and simply say, "Sorry, let me check the word. One moment." Pharmacists are used to this, and nobody will judge you for taking a moment to find the right word. Let's move now toward the final part of today's lesson, where we will review everything we've learned, and then close with some practical tips for practicing on your own. Today we covered greetings and opening phrases when you enter a pharmacy. We covered how to describe common symptoms like headaches, sore throats, fevers, and stomach issues. We covered how to answer questions about how long you've had your symptoms. We covered asking for over-the-counter medicine and how to respond to the pharmacist's questions about allergies and other medications. We covered understanding dosage instructions and how to ask for clarification when needed. We covered picking up and refilling prescriptions. We covered asking about side effects and safety warnings. We covered payment, insurance, copays, and asking about generic alternatives. We reviewed 3 full example dialogues that combine all of these phrases naturally. We looked at common mistakes to avoid, and we practiced pronunciation together. Finally, we added some extra vocabulary and talked about cultural differences across English-speaking countries. That is a huge amount of practical, real-world English, and if you followed along and repeated the phrases out loud, you are already in a much stronger position than before you started this video. Before we move to the final tips, let's go through one more full dialogue. this time focused on a slightly more complicated situation, which is asking for advice about a child's symptoms. This is a very common real-life scenario for parents, and the vocabulary here has a few small differences worth noticing. Imagine you walk in with your child, and you say, "Hi, my daughter has had a fever since last night, and I'm not sure what to give her." The pharmacist says, "Okay, how old is she?" You say, "She's 4 years old." The pharmacist says, "And how high is the fever?" You say, "It's around 38 degrees." The pharmacist says, "Has she had any other symptoms, like a cough or a rash?" You say, "No, just the fever, and she seems a bit tired." The pharmacist says, "Okay, I'd recommend a children's fever reducer based on her weight, not just her age, so let's check the dosage chart together." You say, "Oh, I didn't know it was based on weight, thank you for explaining that." The pharmacist says, "Of course, and if the fever goes above 39 degrees or lasts more than 2 days, please see a doctor." You say, "Understood, thank you so much for your help." This dialogue introduces a few new and very useful phrases. The phrase "based on weight, not age" is important because many children's medicines are dosed according to body weight rather than simply the child's age. The phrase "fever reducer" refers to medicine designed specifically to lower a fever. The phrase "dosage chart" refers to a printed table that shows how much medicine to give based on weight or age. These are excellent phrases to remember if you are ever caring for children in an English-speaking environment. Let's add a few more useful vocabulary words before we wrap up, since a wider vocabulary will make you even more flexible in real conversations. The word ointment refers to a thick cream, usually used on the skin, for things like burns, rashes, or cuts. The word lozenge refers to a small tablet that dissolves slowly in your mouth, often used for sore throats. The word inhaler refers to a small device used to breathe in medicine, often for asthma. The word syrup refers to liquid medicine, often used for coughs, and often flavored to make it easier to take. The word antihistamine refers to medicine used to treat allergies. The word antibiotic refers to medicine used to treat bacterial infections, and it is important to remember that antibiotics do not work on viruses, like the common cold. The word decongestant refers to medicine that helps relieve a stuffy or blocked nose. The word antacid refers to medicine that helps with heartburn or acid reflux. Knowing these words means you can be much more specific when describing exactly what you need. Instead of saying, "I need something for my throat," which is still perfectly fine, you could say, "Do you have any lozenges for a sore throat?" which sounds even more precise and natural. Keep practicing, keep speaking, and I'll see you in the next video here on English Speak Lab. Take care and speak soon.